This is cohort number 1, 2023-2024. And this program is being held at the Ministry of Health, Former Town, Tottenham Boulevard, Tuesday, July 30th, 2024, at this hour. This is a closing program. We will now have an opening prayer by our volunteer. Okay, someone please pray for us. Who God has touched this morning. Okay, we ask the Assistant Minister of Finance to please pray for us. Yes.
Let's pray. Our most heavenly and gracious Father, Lord, thank you for this gathering today. Thank you for your kindness. Thank you for the safe that we have everyone here. We pray as our esteemed students have done all they could to be seated where they are today. Policy, evidence-based health policy that has been impacted upon them, that will be able to use this to better our health sector. Pray, Lord, that you continue to guide them and strengthen them to do what needs to be done to improve our sector. Thank you, Lord Jesus.
Amen. Thank you for this great prayer. We are about to start. Having given everything to God, we will now call on our Deputy Director for the certificate course, Bridge U Labour Project, our professor, Kenny.
Good morning, everyone. Good morning. All right, so basically we just wanted to give like a brief overview of what the evidence-based health policy course is about. This is under the BridgeU project at the University of Liberia College of Health Sciences. The BridgeU project is supported by USAID as funding from the US government. But it's under the College of Health Sciences. And basically, it's about training health workers or health policy developers or health policy makers in using evidence-based. We know the world is gearing towards evidence-based now. So in using evidence-based to be able to develop our policies in health, to be able to revise our policies in health, to be able to look even into our programmatic decisions that we make, but we have to make them using evidence, using data. So basically that is what this course is about. I will just go through a short overview. We say this is a collaboration between the University of Liberia, College of Health Sciences, the USAID BridgeU project, Yale University, and also Vanderbilt University. So it's a big collaboration. That's why we have other people here in the room. And it's an executive style education program. It runs for 9 months, and it's 3 days, 3 in-class modules. So we have starting the health policies around here. They say people do not expect that they go to school every day or they go to class every day for these 9 months. So we divided the thing into 3 modules, and they are only expected to be in class 3 times within the 9 months. And they also do like practical projects. So basically, because we are trying for people to be able to generate evidence, find evidence, and use evidence to develop health policies or even revise the health policies that we have, they will have to do projects that will end up being into policy briefs. So they will look for the evidence. They will either do it in groups, because this is our first cohort. So we had them do the activities or their projects in groups. There were 3 members in a group, and I think we had maybe one group, there were 4 members. And then they will be able to do projects of interest. They will take their topic of probably Liberia in health that are paramount. So you will listen to group presentations or presentations from our group members that came up to be policy briefs or policy recommendations that they are making for us in Liberia that will be very beneficial. And also, for the learning objectives for our entire 9 months, we have a lot of learning objectives, but for the purpose of time, we just outline a few here. We want for, at the end of the day, for our participants to be able to define what evidence is and how to use it to improve health policies. And we also want our participants to be able to use search engines and other databases to find available evidence. And when they have found those evidence, how they'll be able to interpret those evidence and use the findings from the evidence that they have gotten across all the sources to be able to align it with their own work that they are doing. And they'll also look at the methodologies, because most times we go online and we use search engines and we find a lot of documents, but then those documents, most times, not all the methods that they use are feasible to be used or to be applied in our look at the methodologies that they use in different countries or within different research and see how they'll be able to use it. And then they'll also be able to describe and apply useful frameworks, because we have a lot of frameworks that people use in analyzing health policies. And then they'll understand how to use these frameworks in different contexts and in different health policy development or health policy revision. So I have my colleague here with me from Vanderbilt University, Dr. Marie Martin. She will also continue with the other learning objectives before we end the overview of our evidence-based health policy program.
Hi, everyone. It is such an honor to be here and to celebrate these graduates of the inaugural evidence-based health policy program. So I have been fortunate enough to work with Ms. Candy and many other colleagues over the course of this 9 months. And I can say there are few programs that have been as meaningful and impactful that I have partnered with colleagues here on. So the future is bright, and it is so exciting to see how these learning objectives are being put into practice now. So in addition to the first slide that covered some of the learning objectives, we also discussed and analyzed different approaches for identifying data and evidence that might not be readily accessible, right? And so if you think about all of the data that's collected by the Ministry of Health, by Infill, by partners, that is valuable to use in policy development, but it's not always easy to find. And so thinking about how you can utilize and understand evidence in the absence of studies that have been done locally that have been published. So we also worked with the colleagues to identify how to both revise and create new policies, especially to meet the particular needs here in Liberia. And then with all of our sessions and our separate mentored sessions, we really harnessed the power of peers in thinking about how to collectively create, crowdsource for ideas, and leverage the great brain power that is here towards improving the health and well-being of populations. Our last slide, we had lots of learning objectives. We were really, really ambitious and are so thrilled to see this, as a successful program. The third set of learning objectives, we're really thinking about how to take the lessons from this course and apply them in the future, right? So thinking about what would be ways to harness the data that is currently available here in Liberia to be able to utilize that for health policy decision making, how to think about collaborations and reaching across departments to build and create policies that can have the greatest impact for the country. So also selecting communication strategies for different audiences and sectors. And I think you'll see that demonstrated in the two presentations today, where our teams have harnessed the potential of visualizations to really capture and communicate messages in a compelling and effective way. Developing the policy briefs was a clear, concrete deliverable for all of our participants, and to see those really grow in their robustness, in their clear outlined interventions was so fulfilling as a facilitator. And then lastly, we know that policies don't occur in a vacuum. And sometimes there are political aspects of policies that need to be understood, and certainly partnerships and stakeholders that need to be incorporated at all stages of policy development. So we had opportunities to think about different partners, to imagine ways to work more effectively together to improve and create some health policies that really are rooted in the evidence. So with no further ado, I will let you see some of these objectives demonstrated by two teams who were selected by their peers and facilitators to showcase examples of what the products are from these separate modules and mentoring sessions. So we will start with
I want to say a big thank you and a round of applause for our professors. We now have a selection by one of the participants, Matrix Angie Brown. So please. I will do a song on behalf of the class that say you are God. Amen. You can help me. You are God from beginning to the end. There's no place of argument. You are God all by yourself. You are God from beginning to the end. There's no place for argument. You are God all by yourself. You got time and season in your hand. You know my life all darkness. You don't need a man to be the God you are, but you have chosen to call me your own. So you are God from beginning to the end. There's no place for argument. You are God all by yourself. And here we are today, after 9 months, we are here to receive our award. Thank you so much, Angie, for lifting our spirits this morning. We will now have a testimonial for the program, and that will be from our own minister, George Jacobs. the Assistant Minister for Planning and Policy, Ministry of Health.
Good morning. Good morning. Dr. Catherine Cooper, Chief Medical Officer of Liberia, the Minister of Health. Dr. Masakwe, Head of Clinton Access, Health Access in Liberia. Our professors, facilitators, the distinguished graduates, briefly listed, our partners, USAID, colleagues of the Ministry of Health, one and all. You've listened to Marie and Kenny clearly explain the objective and what this was all about. So my own role here is to tell you, as a student of the course, how important it is, what benefit we collected as beneficiary of this course. As it is, you cannot talk evidence-based policy anytime more relevant now than before. We've been talking this long before, but it's more relevant now than ever before. Why so? Because there are issues of limited resources around the world, and the challenges continue to mount. And Liberia being a resource-constrained country, we cannot overemphasize the importance of evidence-based policy course like this one. So over the last 9 months, we're exposed to a lot of things. We learned a lot as outlined by Candy and Marie. We were exposed to searching evidence. So we're not very strange to evidence-based policy, but this course brought a new dimension, a renewed motivation, a renewed vigor to put evidence at center stage in the policy making and management of the health system. And so through the 9 months, we learned a lot, searching evidence, looking at online databases, peer-reviewed journal articles, and evaluating those data and articles that we found to see how relevant they are to our context, our country, and the situation we're trying to look at. And from that, we're able to develop policy briefs that will be able to help us inform our health system policy making. What I want to stress this morning is that this was not just only for policymakers, though most of the first batch are when we are in policy position, but it is actually for those that are managing the health system at all levels. Because it brings, as I said earlier, evidence to center stage in management and policy decision making. So I would encourage all of us, our colleagues, as you are looking at me in the field of Nelson is here, I see Nelson, I see Photon, and all of you from the Ministry of Health. I hope you guys will be the next target for this post because it provides that understanding to be able to actually do your work based on information, not guesswork. Most time when we go to our activities, do our plans, we end up looking at my own experience over the years doing policy and planning in the Ministry of Health. We see a lot of intervention keep coming over and over and nothing changing. So the reason is, the point is, why is this so? Why are we doing the same thing, the same way, and expect different results? As I always said, somebody told me before, that if you do the same thing over and over and expect different results, you need to check yourself at the mental hospital. Understand? So we have to do things differently, using evidence to ensure that what we do as policymakers or program managers as well as implementers is based on available evidence. And sometimes we overlook ours. There's so much evidence that we have that we make use of. We are able to jump to conclusion when we are making decisions or doing programs or policy, but the data are there, and sometimes we are a little lazy to look at them. But they direct our path and ensure that whatever resources we are investing is able to achieve the maximum result because evidence is center stage. So to conclude, I want to extend thanks and appreciation to the UL, British UL, the USAID team for supporting this course, and we all will be able to work around to strengthen it to ensure that it meets our needs as a ministry. As it is already doing, the agenda for what they call it, or rest agenda, and Martin and I and the rest of the colleagues are sort of asking ourselves, where are the evidence? How do we ensure that, because there are so many people to do, okay, we have the resources to do everything. The answer is no. So we have to employ the evidence to ensure that what we are doing is the most effective intervention and the most policy measure that can take us what will be to reduce maternal mortality, ensure that we go to finance health sustainably, and build our health system to be a stronger one in Liberia. So now I want to say thank you so much. I wish all of you congratulations on your graduation, and thanks to all our sponsors, our teachers, and our donors, USAID, for making this possible. Thank you.
I think I was one for the minister. And so, Minister, the CMO, you have heard it. We learned a lot during this course, and I'm sure that we will start publishing very soon. Thank you so much. And as evidence of what we've done over the 9 months, 3 groups were selected. Two groups were selected. It does not mean that they are the best. But they went as far as collecting more evidence to back the papers. And so, and it was very contextual, and I think the selection was based on the low-hanging fruits that we can use as a country right now, or country right now. And so, Minister, we are here to present to you the 2 teams that were selected. We now call on one for their presentation. African Members IT. You don't want to use a laptop for this table. It's a wire. Give me a wire.
presented. I will be presenting our work in the form of data. So the presentation here reflects low middle income countries has high maternal mortality, which is reflected by the intensity of the colors. So from white, and what we have the stripe, at the top you see there is no data because that's where we have Antarctica, and technically we do not have information for that place. And then as the color goes from yellow to orange and red, it presents the intensity of maternal mortality across low and middle income countries. So we realize that in Africa, mostly maternal mortality is high, and Liberia is of no exception. In 2015, which was the end of the Millennium Development Goal, which has clear and defined goals to address challenges in low and middle income countries, maternal mortality rate was reflected as 300,000 per 100,000 population for pregnant women. And then at the end of the Millennium Development Goal, it begins the Sustainable Development Goal, which took over the sources of the Millennium Development Goal to grow. And at the end of the Sustainable Development Goal in 2030, the target is to reduce maternal mortality by fewer than 70 to 100,000 per population. That's why it's been reflected on the board here, and that's what we see here. To be more specific, maternal mortality in Liberia is high, and our DHIS2 reflects 742 deaths per 100,000 population, which is reflected here. In the leading causes of maternal mortality in Liberia, one, we have postpartum hemorrhage, which accounts for 41.2% of the total death. We also have sepsis, which also accounts for 20%, and 17.2, which also accounts, eclampsia, which accounts for 17.2 deaths in Liberia. Notwithstanding, high maternal mortality in Liberia is of major concern, for which we decided to do this research, and the government of Liberia is also concerned about this. In addition to that, we realize that maternal mortality occurs, the death of women mostly occur in health facilities, which we have 89% according to our 2023 report. However, the government of Liberia is committed to addressing the causes and effects of maternal mortality, for which the President of the Republic of Liberia, His Excellency, Honorable Joseph Nima is addressed the need to fight maternal mortality through the delegation, which is going here in May 2024, this year. So the government of Liberia has committed to address maternal mortality in Liberia to give a common path for other countries to be able to address and to meet the targeted goal of the Sustainable Development Goal for 2030. So in our research, we did a couple of reviews from evidence from other countries, and then we summarized our literature. One of the first recommendations was to look at maternal waiting homes. Maternal waiting homes proved to be an effective and efficient way of addressing maternal mortality, where women, expecting women will be at the maternal waiting home before, during, and after birth to be able to address these causes, specifically eclampsia, sepsis, and postpartum hemorrhage. So maternal waiting home is one of our major recommendations that we made, and then we also look at community engagement. The community engagement is essential because community health workers who are particularly engaged in the community have been working effortlessly to be able to produce our effective community health program. In this case, we start from the evidence from other countries to recommend that the community engagement should be a part of our program, and it should be embedded in the community health program, which will effectively review and report every cases of maternal mortality in the country at all stages in every part of the country. The second one, we also realized that in Kenya, referral pathway proved to be one effective and efficient way of addressing maternal mortality. Our research was done on the strategy to reduce maternal mortality in Kenya through strengthening referral pathway. In 2023, our research was done and it showed a way of addressing maternal mortality. It comes to the second delay. We have the 3 delays in seeking healthcare, which is connected to the maternal mortality. That's the ability to decide and reaching the facility to receive care. The referral pathway is one effective way to be able to address the second delay in addressing maternal mortality, which has to do with reaching the health facility. In Liberia as well, we researched and realized there was a cohort study that was conducted in 5 different communities. We had maternal waiting homes, and communities we had maternal waiting homes has less maternal mortality rate compared to those that never had maternal waiting homes. So we realized that there is another way. So maternal waiting homes in other countries, and even in Liberia, is a more contextual situation which we are able to present here in our presentation. So our proposed policy recommendation to the government of Liberia and all other policymakers, we recommend that maternal waiting homes should not just be a point for care, but we should also be effective and efficient by providing essential medicines, motivated health workforce, and provide the quality of care that people need to be able to address maternal mortality. We should also be able to provide food, water, electricity. Those basic logistics will make efficient to address maternal mortality. Our second recommendation is to enhance sensitization in the public, in the general community, where the general public will be able to know the effect, the causes, and the impact of maternal mortality. Because if maternal mortality occurs, it does not only affect the woman alone, it affects the entire family. The child, the husband, the family, and as well as all the family also has a whole lot of effect. And so we talked about a community health assistant and community health volunteers to provide awareness on the benefit of maternal waiting homes, especially in rural communities, and how to reach areas. And we also strengthen referral pathway, which we realized in Kenya was one of the most effective ways to also strengthen our referral pathway to be able to address the second delay for seeking care in Liberia, and also establish an effective maternal waiting home and effective referral pathway for managing OB emergencies and standard operating procedures as well. With this, as a group, our next step is to engage with stakeholders like you, like us, the government of Liberia, and other partners who are supporting health, to get to buy in on our policy recommendations, make publications, and be able to move forward to address maternal mortality and be able to meet the international development agenda like the SDG goals, as well as the president's commitment and the government of Liberia to be able to address maternal mortality. And also our second next step is to be able to do publication of this policy brief so that it should not remain a great literature, but it should be something that people can also be able to refer to in the future, say, okay, Liberia has been able to do a couple of research based on our evidence, and this is what we have. So our publication, our research should be published, and people can use it to refer to us as well for international best practice. At this stage, I would like to say thank you to our professors and our participants for the support.
At this moment, we'll call on to three. Please be ready. That's three. Come on, HR.
Honorable Minister, esteemed partners in health, my name is Santa Elgin from the National Public Health Institute. It is an honor. Honorable Ministers, esteemed partners in health, good morning. My name is Santa Elgin from the National Public Health Institute of Nigeria, and I'm a member of Group 3 from this cohort. I have remained with reduce cervical cancer mortality from the root. That is by implementing effectively the HPV vaccination program at our health facilities, which is highly effective and it's shown that HPV vaccine is capable of preventing more than 9 out of 10 cases of cervical cancer worldwide. To achieve full vaccination against HPV, 2 doses are required to be administered to adolescent girls between 9 to 14 years before their sexual debut, and also at an interval of 6 months. So to meet this goal, Liberia was among 3 countries in West Africa to introduce the free routine immunizing HPV vaccination in 2019. And the target was set at 80%. However, that coverage has plateaued at less than 40% over the years, which is concerning. Our research was conducted in 2022 by the 6th cohort of the Intermediate Field Epidemiology Training Program. And from that research, they decided to ascertain the acceptance, knowledge, and uptake of the HPV vaccine in Montserrat County among caregivers of those adolescent girls. And findings from that research indicates that of all the contributing factors, as we see on the bar chart on your right, the lack of awareness was a primary issue, as reported by 67 respondents in that research. And the knowledge of the vaccine among the caregivers was relatively low at 2% in Montserrat County. To arrive at our policy options, we conducted extensive literature review, and from the summaries of evidence, we would like to propose the following interventions. To conduct awareness reaching at least 80% of the population in Montserrat County by 2026. And in order to reach this population, there should be an extensive door-to-door outreach campaign to directly engage with caregivers in their home, at least to address their concerns and provide those personalized information about the benefits and importance of the vaccine. We should also create an open forum or town hall meetings where the concerns of the communities will be addressed, and our messages will also be tailored to meet their needs, and to make use of the social media platforms to reach a more diverse and large audience effectively. We would also like to recommend the development and the implementation of a mandatory vaccination policy to increase the uptake of the HPV vaccine. In our setting, it may not be common, but this will require collaborative effort. We would need to engage all stakeholders in health, especially community members and leaders, to ensure that this policy is culturally sensitive and effective to increase the uptake of this vaccine. And I think we are privileged in other countries as this vaccine is free. So with it being free, it's cost effective, and we can have people opting in. And then we are amazed that during that research as well, caregivers were even willing to pay for this vaccine in the absence of it being free. So that can tell us how willing people are to opt in for this vaccination under these circumstances. So we'll also need, the process will also involve collaboration. We will need to engage, as I said, other stakeholders in health to make sure we're on the same page. And this really brings success, as we see with the eradication of smallpox globally. We also see other vaccines that have been mandated, such as the COVID-19, the yellow fever, and all that. So maybe we could think about HPV in that direction. Furthermore, we recommend the incorporation of the policy in schools curriculum.
That will lead to a well-informed young population, especially at primary and secondary institutions, to know and understand the importance of HPV vaccine, its effects, and how to prevent it. And that will also lead to those who will educating their informal parents, which will increase the uptake of the vaccine, and also foster a culture of health awareness and proactive disease prevention. So to ensure the success of this vaccination campaign, we recommend the combination of these three strategies to uptake the vaccine nationally. And we intend to go beyond this body, leaving no one behind, to increase awareness on HPV and its effects. And we'd also like to recommend that these interventions that are being proposed is not only applied in Montserrat, but the rest of the other counties in Liberia. And knowing that this is a global fight and that a disease anywhere is a threat to health everywhere, we will go beyond this body, as I said, to conduct extensive awareness on the importance of HPV vaccination among caregivers in Liberia. That will contribute to the global fight of HPV. Let us remember that HPV is a virus we all can beat. Thank you.
What can we say about this presentation? I was mesmerized listening to her. Thank you for that splendid presentation. You have heard the two groups, policymakers, our CMO, USAID, and everyone seated here, show that this group have enlightened the mind on two basic issues that are now of interest to this country. And we all take note and support the two groups. Thank you so much. This is the all-awaited program, a presentation of certificates. And there's an order here.
Okay, so we are all excited for this moment, but formally we just wanted to present our participants, our graduates. So you, Madam Minister, we have a class of 18 participants from Ministry of Health, the National Public Health Institute of Liberia, and the Montserrat County Health Team. So we started with the three institutions. We hope to extend to go further in these three institutions because from our after action review, we got recommendations that due to the One Health platform, we should also include Ministry of Agriculture, EPA, and the National Disaster Management Agency, because most of the health policies that are being developed or revised can involve these ministries also. So it will be good for them to also benefit from the knowledge in knowing how to search for evidence and how to utilize evidence to develop policies. So our class was a cohort of 18 persons. Our cohort, first inaugural cohort, was 18 persons. And I'm very pleased to present to you these 18 persons. I think we are missing one person. She's presently out of the country. So today we have 17 persons here with us. All right, so can we ask all the graduates to please stand up so we can present you all to our minister? So we want to say congratulations to you, Madam Minister. This is our first one for the evidence-based health policy. We are confident to say that when we have policy development or policy revision, instead of us taking the back seat, we can take the front row in even drafting the first draft of our policy. We can have partners or other people help us, but we will be able to take the front row in moving our policy forward. So these are the people that you will depend on until we have the next graduates. For now, for policy revision, policy development, searching for evidence, making sure that you have evidence in your documents, whether it's programmatic or it's national, to make sure that we have evidence in it to be able to make a case why we need this policy or why we need this work to be done. So for the presentation of the certificate, we'll start with you for you to give our first few graduates their certificates here. Thank you. All right, so for the first person, we call on Alexander Arele.
So let me read what's on the certificate, at least for the first one. It's a certificate of attendance. This certificate serves to certify that Alexander Ireland has participated in the evidence-based health policy course offered by the University of Liberia College of Health Sciences in collaboration with Yale and Vanderbilt University. On this 30th day of July 2024, it is signed by Ernest Nam, the Vice President of the Health Sciences University of Liberia, and by Chelsea Plyler, the Project Director of Bridge U Liberia Yale University.
All right, the next person is Kolu Jawe Howe. Next is George Taylor Jacobs. And we have Stephen Lama. So please present our She is our representative from the USAID. Okay, the next person is Alberta Palmer, but she is not here. She's presently out of the country. And we have Alberta Cornell Dudley. And we have Carlton Pan. We also have Martin Dumo. Next is Grace O. Wester. We have Yoli Waka Wester. Diana T. Sarton. Do we have someone from the National Public Health Institute here? Yes, the Deputy Director for Technical Services, Dr. Guilherme, would please give All right, we have Ernest Goyum. Angie S. Travis. Siata L.A. Green. And next we have Justin A. Corbett. And we have Stella B. Nelson. Thank you so much, Dr. Guilherme. We now call on from the University of Labrador College of Health Sciences to present our finals. We have Alvan A. Coker. We have Yata Saki. Thank you, Jessica.
So graduates and the audience, please give a big hand clap. We are almost there. We are now on the remarks section. We'll go the reverse because this is the Ministry of Health. When Ministry of Health speaks, no one speaks, right? So we will start with the University of Liberia College of Health Sciences for remarks.
Permit me to stand on as a simple request. On behalf of the College of Health Sciences and on behalf of the President, Dr. Bernie Steve-Dan, we want to say congratulations to the graduates, and we want to say thank you to our partners for imparting knowledge into you. And not to go into many words, I want to leave something with you that is very intriguing. The first time I heard it, that galvanized me to make sure that whatever I do, I impact the next person that is near me or with within my space or around me. And we have this top 9 Liberia that we say think Liberia, love Liberia, and build Liberia. And whatever knowledge you have, if you can impact the next person, that means you have not done anything. So all of us that are either part of the Christian faith or any other faith, we know that we have 70 years of life. By grace, you go more than 3 scores and 10. So there are 365 days in a year. If you can take your calculator, times that 70 years by 365 days, that means you have 25,550 days to live here on earth. If by grace, God doesn't give you a long life. So now calculate your present age, minus it from that 70, and then times it by 365 days. So let's say now you are at 55 years, minus it from 70 years, you have 15 years. Times it by 365 days, you just have 5,475 days to live here on earth and impact the earth. So let's imagine that you are at the half of your age, or better still, you are less than 50 years, you still have that time to impact the next person near you or your generation. I just want to encourage you that every time you think that as your age is increasing, you have that less time to impact. So whatever you are learning, you have learned here with the evidence-based training, I hope that you will now become to start to think Liberia, start to build Liberia, but you can only do it within the space around. So I want to congratulate you again on behalf of the College of Health Sciences.
We will call on USAID. Representative Pamela Sawyer.
Allow me to stand on the existing protocol. About 4 months ago, I was asked to teach a course in health policy. I had 3 students from all of Africa online, and the rest of the people from Nigeria. And one of the things that I struggle with my class, that class is over now, that I struggled with was acquiring data, evidence to design a health policy. I told everyone, I'm not going to give you a design, I'm not going to give you quizzes. I'm going to ask you to design health policy at the end of this course and submit it and present it. It was really challenging for a lot of them. You know, with that being said, I'm honored and excited to stand before you here today to celebrate the achievement of these great leaders. Today marks a culmination of almost a year, 9 months of hard work and dedication in the development of skills that could be applied in designing evidence-based health policy. As you step into this vital role, remember that your role is crucial in translating research into practice and shifting health systems that are effective, equitable, and sustainable. Minister Jacob mentioned something like that when he was doing his presentation. As you all know by now, evidence-based health policy hinges on using the best available research to inform decision-making and ensuring that policies not only address current health challenges, but also anticipate future needs. This is an area that I see we struggle with in this country because when we designing health, we are all health policymakers here. We don't so think about the future, 5, 10 years from now. We need to look at what's the feeling in currently. Please remember that. We expect that the expertise and skills that you have developed over these 9 months will drive improvements in health outcomes by integrating rigorous data analysis with practical real-world applications. On behalf of USAID, I extend our heartfelt congratulations and best wishes to all of you. We look forward to seeing the remarkable contributions you will make and the positive impact and changes that you will inspire. Congratulations to all of you once again, and congratulations to University of Liberia for moving this program forward.
Thank you, USAID, for that remarks. Whatever you say here today is noted. We now call on the Public Health Institute of Liberia for their remarks.
Good morning. Good morning, everyone.
Good morning.
So let me firstly say congratulations. Congratulations to the graduating class. It's graduating class, right? Yeah. Start by expressing on behalf of the National Public Health Institute of Liberia our great delight and excitement for this significant milestone that we've achieved. And perhaps this is the first of its kind in addressing what we refer to as the evidence to policy translation gap across the research policy implementation continuum. I was fortunate to do a postgraduate research on the extent to which evidence generated with the Ebola virus disease epidemic was utilized to inform policies on Ebola treatment in Liberia and other parts of the world. Unfortunately, it was realized that despite an outbreak like Ebola, with the skill and the size of over 10,000 cases, we were unable to generate sufficient evidence to inform policies on Ebola treatment. It was often a case that we had to wait for researchers from foreign countries to dictate research interventions, activities, and to inform policies within our setting. Fortunately for us, significant achievements have been made post-EBD, and this is one of the evidence that we see here. I want to particularly express my thanks to the University of Liberia for the new dimension, the new analysis, and the broader public health training in Liberia. I'm particularly impressed by the level and the extent of collaboration here today. We see persons from research institutions, from the university, the Ministry of Health, partners, policymakers, of course. And although I'm not too certain, but is there anyone from the Ministry of Finance here? So it's just an appeal. I mean, subsequently, we should include policymakers at that level because most of these things have resource implications. And it's always important or significant to understand how evidence are generated so that in the future, when public health experts and technicians are presenting a particular public health problem and recommending policy decisions or actions, people within the other sector can have a full understanding of how these evidence are generated. We, like I said, anticipated that This entire process will be the beginning of shining the light on research evidence and how they are used to inform policies. And like the previous speaker said, our policies should be strongly grounded by the best available evidence. And I have no doubt, because I've engaged directly and indirectly with some of the members of this graduating class, particularly those of the Public Health Institute, with the extent of rigorous training. We hope that to help improve policy decisions within the health landscape in Nigeria. Thanks to the University of Liberia once more. Thanks to our partners, the Ministry of Health, but more particularly the graduating class, okay, for enduring through this period of time. It's 9 months, right? 9 months or more. And some of you may have had your own personal or professional obligations when you committed yourself to this process. Congratulations once more, and let us all continue to make our own positive strides to improve the health system responsiveness and resilience in Nigeria. Thank you.
Who is now, I now have the honor to call my boss lady, the Chief Medical Officer of the Republic of Nigeria, Captain Popo. Good morning to all. I believe it's still in the morning. Our distinguished colleagues from the Ministry of Health, our ministers and other colleagues, our partner organizations that are represented here, the University of Liberia, and the team of instructors for this course. Personally, and on behalf of the Ministry of Health, wish to extend congratulations to our graduating class, but also congratulations to the University of Liberia for achieving this hallmark in our health system of developing a course, an evidence-based course. It is a step towards creating a culture in our society, in our health system, of using evidence to make informed decisions. Many of the speakers before have emphasized how important it is for Liberia to join other colleagues around the world to use evidence to make decisions in our health system. We have many policies that have been developed over time, and the tendency is always to invite external colleagues to come and assist us to review our situation, review policies, and assist us to develop these policies. It is about time that Liberians develop that culture and use our own internal expertise and skills to make policies based on evidence. And you see that this course has achieved that. It is the first cohort, but we know that many others will follow, and we are assured that our donors will continue to fund this program because it is so important to build a culture in this country and in other countries where evidence is being used. In Liberia, we have so much data that can inform us about how our policies are supposed to be crafted. And many times we do not look at the data to inform the policies. Many times we do not look at the data to inform our interventions and actions. And we fall short as a country of making decisions and policies that are contextualized to our country. So with this cohort, I'm happy to see that it cuts across the Ministry of Health, the Public Health Institute, Montserrat County, our county health teams. We stand prepared with the skills that have been generated and harnessed in all of you, that we are now set to use the evidence that are before us here in our health system to inform our decisions concerning policies. With the onset of the new administration, we start in a reflection. Many of our policies are grounded on recommendations from the World Health Organization and our international partners. And we have been implementing those policies for several years, but we still see gaps in our health system. We still see gaps in our interventions. We are still far from achieving some of the targets that we want to attain. We have a target of achieving universal health coverage, but we still find ourselves lagging behind. So it's an opportunity now for us to relook at our policies and see what is it that we need to strengthen, what is it that we need to do different. And we are so happy now that we have trained and qualified and skilled people who can assist us to review those policies and help us to direct our interventions, our strategies towards what will really work in Liberia, what will change the tangent of our existing health system, so that in the next 5-6 years, we are closer to attaining universal health coverage than we were before. Because now we have the evidence that we need to review. Of course, comparing with evidence from the international landscape, because we also know how to research and compare evidences, review evidences, and then bring it home to Liberia, so that the decisions and the policies that we make will be based on those evidences. So I'm happy that we have this first cohort. I would, on behalf of the Ministry of Health, extend our appreciation to the crafters of this course. We also want to extend our appreciation to the donors, to the universities who have come to join us, providing their expertise, to the instructors who patiently work with our students and carry them through the course, ensure that they did not just sit there, but they grasp the concepts and are now able to practice it, because I see that the course was very practical, which is very commendable. So to say thank you to our donors and all who are part of this course. For coming back to our graduates, to say congratulations. Thank you for your commitment and your dedication to the course. You know that we all are busy. Everyone in this health sector is turning and turning because there's so much to do. But you still found the time to pay attention to the course, learn the lessons, grasp all the concepts, and we look forward to what you can deliver to the health system. We depend on you to be that light for our health system now as we move forward, even at this critical time. So congratulations and thank you all for this evidence-based policy program. Thank you. so much. Thank you so much for everything. As an MC, I also want to say thank you. We are almost at the closing. Every star the MC just came up. We will also call, when you open, you have to close. So we'll call our Assistant Minister for Vital Statistics again to please close our program. We don't want to mix the prayer of God will hear one person.
Let's pray, please. Our most eminent gracious Father, Lord, we want to say thank you for the program that I just announced. We pray that the graduates, as they are being impacted with this knowledge, will be able to use it to positively impact the health sector of Liberia. We pray, oh God, thank you for the contributions from partners, USAID and University of Liberia, and all the contributions that were made, also the professors for putting their time and effort into training these special ones. Pray that there will be more opportunities for some of us to come and join them too. And we pray, oh Lord, that you let your will be done in Jesus' name.
So I have been told our professors that they do not leave. You just go on your right, just move the next zone, the lunch will be served. So yes, why? Group photo, please.
The graduates and I saw my squad. Let's go.